Blood cancer. Your blood is made up of three different cell types: red blood cells, white blood cells and platelets, which is produced by the stem cells in the bone marrow, which is soft sponge-like material in the center of your bones. Blood cancer affects how your body produces blood cells and how well those cells work. Most blood cancers start in your bone marrow, and some of them start in the lymphatic system. Lymphoma is a broad term for cancer that begins in cells of the lymphatic system, particularly lymph nodes. The lymphatic system is part of the immune system, which produces immune cells called lymphocytes, which protect the body from infection and disease. There are two different types of lymphomas: Hodgkin and non-Hodgkin lymphoma. Leukemia is a type of blood cancer that begins in the bone marrow. The bone marrow starts making abnormal white blood cells, which overthrow the normal white blood cells along with the red blood cells and platelets. All of the normal cells can no longer function correctly. Myeloma is a type of blood cancer that specifically affects B cells, plasma cells, a type of immune system cells in the bone marrow that normally produces antibodies to protect against infections. Myeloma bone fracture affects your body's immune system, leaving it susceptible to infection. Chemotherapy. Chemotherapy is a form of cancer treatment in which chemicals are used to kill cancer cells. It is frequently used as the main form of cancer treatment. Immunotherapy. Immunotherapy is a type of cancer treatment which uses substances to boost the immune system and help the immune cells in your body find and destroy cancer cells. This cancer treatment targets genetic changes or mutations that turn healthy cells into abnormal cells. Bone marrow transplant. Bone marrow transplant (BMT) is a special therapy for patients with certain cancers or various non-cancerous conditions. A bone marrow transplant involves taking cells that are normally found in the bone marrow, stem cells either from the patient himself, autologous BMT, or from a matched donor, allogen ICBMT, filtering those cells and giving them back to the patient.